Hi, this is Matt Richmond from Chartwell Willow in British Columbia. I'm going to give a brief summary of my business plan for the capacity issues faced by the hospital emergency room. Basically, I looked at the external factors and the root cause of what's been causing the increase in patients to the hospital emergency room. And looking at the external factor of the clinic closing, which is out of the control of any of the hospital administration, meaning that action needs to be taken in order to maintain the levels of service and meet the financial requirements without increasing overtime. How I looked at this was trying to take a modern approach as to the triage or the assessment, if you will, process through channels of social media. Creating a platform for the hospital emergency room to have patients seeking medical intervention, but looking at the facts of the increases mostly in CTAS 4 and CTAS 5. These are non-serious emergencies where most individuals would require more insight or be wondering, should I go into the hospital? Should I seek a medical intervention? The creation of the platform, in my mind, was using the hospital social media channels to give patients access to real-time communication with a triage nurse, where they're able to upload possible images of lacerations or skin irritations, anything dermatological, that they're able to give a visual assessment to a triage nurse, as well as informing the nurse about symptoms they're having, and subsequently the nurse is capable to ask the questions that they're needing to ask at that time as well too. Through this platform, the triage nurse is able to create a snapshot of what this individual is going through or what their ailments are, and upload it for the physician to attend to the computer, bring up the social media or the platform database, and have access to these types of this type of information. To at which point the physician can request either this individual come in and seek medical intervention, or give a suggestion to another avenue of satisfying the need for this individual's curiosity as to whether they should be coming into the hospital or not. My thought process about this is, one, it's placing the hospital into a very high modern technology capacity, where the hospital is able to develop further systems and stay ahead of a technological curve of communication, which millions upon millions of people are tapped into through social media marketing and social media channels. However, the downside is it does not give a tangible ability to assess via vitals and blood pressure, blood cultures, things along those lines, to where basically with this category of CTAS 4 and 5, the nurse is able to make the recommendations, and the physician is able to make the recommendations while maintaining the queuing system for more serious medical intervention needs for patients. Financially, platforms like this can be created and monitored for up to $1,200 a month, or even more, or less. There's a lot of variety and varying for how these social media channeling platforms can be created and maintained to meet the needs of the service that's utilizing them. The increase of capacity of one registered nurse per shift, maintaining the online or social media triage platform would also be required. the main focus and goal is to limit the amount of time a doctor has on non-serious emergency reasons, where a physician and nursing staff are able to give the best quality of service to those individuals that are needing it, and maintain a structured triage queuing system, as to where the individuals in more serious need are getting the best treatment possible. Not saying that individuals in CTAS 4 and 5 don't deserve better care, but it's time away from physicians and nurses tending to people who do require them. Also, speeding the tangible queuing system in the hospital itself, making that much more efficient, where the wait time will decrease, overtime will be less required, as there's a predictability more so into who is coming into the emergency and for what reasons. The more insight given, the better you can forecast for departmental expenditures such as labor. That is my approach as to how I envisioned dealing with a queuing system, or a capacity issue such as that. Any type of manipulation that would be required is definitely mandatory, due to the fact that an increase is out of the hands of hospital administration, and taking the opportunity to not just add a new staff, but which would be the easiest step, is to add more nursing, but you're still seeing that physical ailment on the staff itself, and subsequently the level of care is going to still remain the same, where placing something into the system along a social media channel, where the physician is able to have a summarized version with photos, symptoms, recommendations from the nurses, into a platform where the physician can just open the computer and have access to, this individual is categorized as CTAS 4, CTAS 5, these are their questions, these are the images of what they're wondering. The physician can then make the determination in a very quick manner: yes, this individual should come in, or no, this individual should not come in, and seek medical intervention from their family practitioner or something along those lines. Whereas the treatment is still there, the satisfaction towards the potential patient or patient is being satisfied, and the no breaches of the ethics has been compromised, if you will. So that's my thought, and thank you for watching.